Well, thank you so much, and I would like to now invite Dr. Geetha is not there. Dr. Geetha, here, please, for a talk on role of anti-segment OCT in corneal and ocular surface disorders. Dr. Geetha, please.
A very good afternoon to one and all of you. We've seen the various uses of MS39 in different aspects of refractive and corneal conditions, and what I will focus upon is on the role of the ASOCT in ocular surface disorders. Can we have the screen, please? So we have understood the various aspects of ASOCT and the role of ASOCT in various conditions in the cornea and ocular surface. In ocular surface disorders, it's primarily with respect to decision making, especially when you are planning surgeries in these patients. Dry eye, there is a definite role with respect to TMH, the tear breakup time, and especially the scleral lens fitting, which has already been focused upon. And I'm going to take you through one specific area here, which is ocular surface tumors, where MS39 has a significant role to play. Before we go into the ocular surface tumors, in ocular surface disorders, well, when you have to decide whether you're doing a limbal stem cell transplant with or without a corneal procedure, whether lamellar or penetrating, ASOCT has a definite role to play in terms of understanding the status of the underlying cornea, the presence of thinning, the presence of scarring, which will tell you whether you need to combine your ocular surface reconstruction along with a lamellar or a penetrating keratoplasty, and that is where it has a very, very important role to play in these ocular surface disorders. Ocular surface tumors will form the mainstay of my talk, and we all know that in ocular surface squamous neoplasia, the classic triad of hyperreflective epithelium, increased epithelial thickness, and an abrupt transition between the normal and the abnormal epithelium is what helps us to clinch the diagnosis in cases of OSSN, as you can see here. More importantly, with the advent of topical chemotherapy, ASOCT helps us to understand the resolution of the lesion. As you can see here, with 2 cycles of topical chemotherapy, there is a significant resolution and normalization of the corneal epithelium following the onset of topical therapy. This is another serial clinical as well as ASOCT pictures which show you how the lesion resolves and the role of ASOCT in helping you come to an understanding as to when you would need to stop the topical therapy in these patients. This is a patient of corneal OSSN where you can see the significant thickening of the corneal epithelium and the complete normalization of the epithelium over 3 years of follow-up, showing no evidence of any recurrence. So this is again a serial ASOCT picture of the same patient. Here again you can see how serial pictures with topical chemotherapy starting from June 2022 with multiple cycles of topical therapy shows a complete normalization of the epithelium, and one cannot underestimate the role of the ASOCT when you're treating these patients. Again, it helps you to understand whether there is what the depth of the lesion is, whether there is scleral involvement, because your management in patients of ocular surface tumors changes when you have an involvement of the underlying sclera. It also helps you to monitor these patients post-treatment and helps you pick up an early recurrence when there is a thickening of the corneal epithelium, and when you are in doubt, it is best to do an ASOCT where you get a classic feature of the recurrence and you can restart the treatment in these patients. We know that pigmented lesions are another important aspect of ocular surface tumors, especially the conjunctival nevus with which a lot of children present, and ASOCT again plays a very important tool here in helping us document and follow up these patients to monitor any change in the size or depth of the lesion. It also helps you to clinch the diagnosis of nevus by the presence of these classic cystic spaces that you get in these nevi, and this is a serial follow-up of the same child over a 2-year period where you document stability of the lesion and therefore decide just to observe these patients. So these are different ASOCT as well as clinical picture scans of patients with pigmented lesions where ASOCT has a definite role to play. Apart from nevus, the other pigmented lesions that we see are PAM and melanoma. With the PAM, it is an absolutely flat lesion without any cysts, unlike your nevus and your melanoma. And it is just a hyperreflectivity of the basal epithelium that you see in these patients. Pigmented lesions always tend to have a backshadowing, and when you're dealing with a thick lesion like this where you're suspecting a melanoma, this is probably one limitation of the ASOCT where you cannot image the deeper aspect of the lesion and therefore would have to probably depend upon UBM to understand better the deeper aspect of the lesion. Lymphoproliferative lesions form the third most common lesion that you see in ocular surface tumors, and this is a patient that we recently operated upon with a salmon pink patch in the conjunctiva. And when you suspect a lymphoproliferative lesion and you get the ASOCT done, contrary to your OSSN, these are classical subepithelial lesions where the epithelium is absolutely normal in thickness and the subepithelial lesion has a more homogeneous hyporeflective texture on the ASOCT. And you can see serial pictures over a period of 6 months. The lesion has actually increased and this patient underwent an excision biopsy, which is the only way of clinching the diagnosis in these lymphoproliferative lesions. Again, some more examples of these lesions. When it's very large, you will have to fall back upon UBM. And one differentiating condition from lymphoproliferative lesions or thickening of the sclera is you need to rule out scleritis, where it will actually show you a thickening and edema of the sclera, unlike the lesions that I showed earlier. So just to sum up, some examples of a cystic lesion where ASOCT has a role to play, the pterigem and pinguicula, which was already discussed, and this is just an algorithm about the different conjunctival lesions that we see and how we could utilize ASOCT as an important tool and a very, very important adjunct in the diagnosis and management of these